Hello everyone. We are going to discuss frontal bone in human skull. The frontal bone is an unpaired bowl-shaped bone located in the forehead region. It contributes in forming the anterior part of the skull. The frontal bone lies superior to the nasal bones and anterior to the parietal bones. Anatomy of the frontal bone. There are three parts of the frontal bone. The squamous part of the frontal bone is the largest part of the bone, and it forms the area of the forehead. The squamous part houses the frontal sinuses. The pair of sinuses are separated by a septum and are located above the orbits. It also contains the frontal eminences and glabella. The orbital, or horizontal, part of the frontal bone forms the roof of the orbit and ethmoidal sinuses. The orbital part consists of two orbital plates separated by a gap, the ethmoidal notch. It also includes depressions for the lacrimal gland. Finally, the nasal part is located anteriorly between the two orbital parts of the frontal bone. The nasal part of the frontal bone forms a portion of the nasal cavity's roof. Surfaces and landmarks of frontal bone. The frontal bone has an external and an internal surface. Several anatomical landmarks and structures can be found on each surface. The external surface of the frontal bone features the following landmarks. 2 frontal eminence. 2 supraorbital margin, featuring frontal notch, or foramen. Supraorbital notch, or foramen. 2 superciliary arch. Glabella. Temporal line. Temporal surface. 2 zygomatic process. The frontal eminence is a round elevation on each side of the frontal bone. It is located above the supraorbital margin on both sides of the frontal suture. The supraorbital margin is the upper orbital margin of the frontal bone. It features the superciliary arch and the frontal notch. The frontal notch, sometimes manifests as the frontal foramen, is an opening on each of the supraorbital margins of the frontal bone medial to the supraorbital notch, or foramen. The frontal notch or foramen serves as a passage for the supratrochlear artery, a branch of the ophthalmic artery, and the medial branch of the supraorbital nerve. The supraorbital notch, sometimes present as the supraorbital foramen, is an opening that looks like a notch or a hole located on each of the supraorbital margins. It is the passage for the supraorbital artery, another branch of the ophthalmic artery, and the lateral branch of the supraorbital nerve, a branch of the frontal nerve that arises from the ophthalmic nerve, CNV1. The superciliary arch is an elevation on the frontal bone above the upper margin of each orbit. Both superciliary arches are joined together by the glabella. The glabella is a smooth elevation on the outer surface of the frontal bone. It is found above and between the eyebrows. The temporal line of the frontal bone is the continuation of a line formed by the union of the superior and inferior temporal lines of the parietal bone. Laterally from the temporal line, there is the temporal surface of the frontal bone. It contributes to the formation of the temporal fossa, forming the anterosuperior part of the fossa. Finally, the external aspect of the frontal bone features one process, the zygomatic process. A zygomatic process refers to a part of a bone that articulates with the zygomatic bone. The zygomatic process of the frontal bone is an extension of the bone lateral to the orbit. It is the process for frontal bone's articulation with the zygomatic bone. Orbital part contain. Lacrimal fossa, which is a depression for the lacrimal gland. Trochlear fossa, which is a small depression for the attachment of the superior oblique muscle of the eye. The internal surface of the frontal bone features 2 important landmarks. Frontal crest. Groove for superior sagittal sinus. The frontal crest is a median ridge on the internal surface of the frontal bone for attachment of the falx cerebri. And the groove for the superior sagittal sinus is a shallow depression found on the frontal, parietal, and occipital bones forming a channel for the superior sagittal sinus. As the groove passes downward, its margins come together and become continuous with the frontal crest. The frontal bone articulates with parietal bones, at the coronal suture. Sphenoid bone, at the sphenofrontal suture. Ethmoid bone, via the nasal part. Nasal bones, at the frontonasal suture. Zygomatic bones, at the zygomatic processes. Maxillae, via the nasal part. Ossification. Develops through intramembranous ossification from two ossification centers. Initially forms as two halves, which fuse along the midline by the age of 2, forming the metopic suture, persists in some adults as a remnant. Clinical relevance. Frontal sinusitis. Infection or inflammation of the frontal sinuses can cause pain and swelling in the forehead region. Fractures. Trauma to the frontal bone may result in fractures, particularly in the supraorbital region or the anterior cranial fossa, potentially causing CSF leaks. Persistent metopic suture. In some adults, the metopic suture does not fuse completely, which may be mistaken for a fracture in radiographs. That's the end of frontal bone anatomy. Now we are going to discuss anatomy of occipital bone. The occipital bone is a single, irregular bone located at the posterior and inferior part of the skull. It forms the back of the cranium, contributes to the cranial base, and houses the foramen magnum, which allows communication between the brain and the spinal cord. The four parts forming the occipital bone are: basilar part, two lateral parts, squamous part. The basilar part is the portion of the occipital bone extending anteriorly from the foramen magnum and joining with the body of the sphenoid bone. This part of the occipital bone is also known as the basiocciput. It has two surfaces, internal and external. The internal surface of the basiocciput features the two anatomical landmarks: clivus and two grooves for inferior petrosal sinus. The clivus is a sloping medial surface of the basal part of the occipital bone behind the dorsum celli of the sphenoid. The clivus slopes downward to the foramen magnum. It is occupied by the medulla oblongata and pons. The groove for the inferior petrosal sinus is formed by the junction of the petrous part of the temporal bone with the basilar part of the occipital bone. As its name suggests, this groove lodges one of the dural venous sinuses, the inferior petrosal sinus. The external surface of the basiocciput features the pharyngeal tubercle, also known as pharyngeal eminence. It is a prominence on the inferior aspect of the occipital bone that serves for attachment of the pharyngeal raphe. Lateral part of occipital bone. There are two lateral parts of the occipital bone located on each side of the foramen magnum. Each lateral part has an internal and an external surface that feature some important anatomical landmarks. The internal surface of the lateral part features the groove for the sigmoid sinus. This groove can be seen in the posterior cranial fossa, found on three bones: occipital, temporal, parietal. It begins from the lateral part of the occipital bone, curves around the jugular process on the mastoid part of the temporal bone. Finally, turns sharply on the inner surface of the parietal bone, continuing as the transverse groove. The external surface of the lateral part of the occipital bone features the following structures: occipital condyle, condylar canal, hypoglossal canal. The occipital condyle is a process on the occipital bone for articulation with the first cervical vertebra, the atlas, C1. Posterior to the occipital condyle is the condylar canal. It is a bony passage in the lateral part of the occipital bone that transmits a vein from the sigmoid sinus. The hypoglossal canal is a bony passage that originates from the lateral part of the occipital bone anterior to the foramen magnum and ends on the outer surface anterior to the occipital condyle. This canal transmits the hypoglossal nerve, cranial nerve 12, and the venous plexus. Squamous part of occipital bone. The squamous part of the occipital bone is also called squama of the occipital bone or occipital squama. Like other parts of the occipital bone, it has an internal and an external surface. The internal surface of the occipital squama features the following landmarks: cruciform eminence, internal occipital protuberance, internal occipital crest, groove for superior sagittal sinus, two grooves for transverse sinus. The internal occipital protuberance is a prominent midpoint of the cruciform eminence, a cross-shaped bony prominence found on the internal surface of the occipital bone. Occasionally, from the internal occipital prominence to the foramen magnum extends a thick bony ridge called the internal occipital crest. The groove for the superior sagittal sinus is a shallow depression on the frontal, parietal, and occipital bones forming a channel for the superior sagittal sinus. The margins of this groove come together as it passes downward and become continuous with the frontal crest, a ridge on the internal surface of the frontal bone. The groove for the transverse sinus is located bilaterally on the internal surface of the occipital squama extending from the internal occipital protuberance to the lateral angles of the occipital bone. As its name suggests, this groove lodges the transverse sinus, which is one of the dural venous sinuses. The external surface of the occipital squama features the following anatomical landmarks. External occipital protuberance. External occipital crest. Superior nuchal line. Inferior nuchal line. The external occipital protuberance is a palpable bony projection in the middle of the occipital bone. Occasionally, extending from the external occipital protuberance to the foramen magnum is a bony ridge called the external occipital crest. The superior nuchal line is a transverse ridge located on the external surface of the occipital bone at the level of the external occipital protuberance. It is the attachment site for the occipital belly of the occipitofrontalis muscle. The inferior nuchal line is another transverse ridge on the external surface of the occipital squama. It extends between the superior nuchal line and the foramen magnum. The semispinalis capitis muscle attaches between the inferior and the superior nuchal lines. The occipital bone articulates with parietal bones, at the lambdoid suture. Temporal bones, at the occipitomastoid suture. Sphenoid bone, at the basilar part. Atlas, C1 vertebra at the occipital condyles. The occipital bone develops from both intramembranous and endochondral ossification. Initially forms in 4 parts that fuse during early childhood. Squamous part. Basilar part. 2 lateral parts. Clinical relevance. Occipital neuralgia. Irritation or injury to the occipital nerves can cause chronic pain in the back of the head. Basilar invagination. A condition where the basilar part of the occipital bone invaginates into the foramen magnum, compressing the brainstem. Trauma. Fractures involving the occipital bone can damage the foramen magnum structures, leading to life-threatening conditions. Congenital abnormalities. Conditions such as Chiari malformations involve structural defects at the base of the skull, including the occipital bone. That's the end of occipital bone anatomy. Now we are going to discuss ethmoid bone. The ethmoid bone is an unpaired bone of the skull that contributes to the medial wall of the orbit and parts of the nasal cavity. The ethmoid bone includes the cribriform plate with openings that transmit the olfactory nerves, cranial nerve 1. This bone also houses paranasal sinuses called the ethmoidal air cells. The ethmoid bone has 4 parts. Cribriform plate. Perpendicular plate. 2 ethmoidal labyrinths. Cribriform plate of ethmoid. Forms the roof of the nasal cavity and part of the floor of the anterior cranial fossa. It has olfactory foramina which are tiny openings in the cribriform plate that allow passage of the olfactory nerve fibers, cranial nerve 1, from the nasal cavity to the olfactory bulb. Another part is crista galli, which is a midline vertical projection on the superior surface of the cribriform plate that serves as an attachment point for the falx cerebri, a fold of dura mater. Perpendicular plate. Extends inferiorly from the cribriform plate. It forms the superior portion of the nasal septum, separating the left and right nasal cavities. Articulates inferiorly with the vomer and the nasal cartilage to complete the nasal septum. Ethmoidal labyrinths, also called lateral masses. It is a paired structure of the ethmoid bone situated in the sagittal plane below the lateral margin of the cribriform plate. The ethmoidal labyrinth separates the orbit from the nasal cavity. This part of the ethmoid features several important structures like ethmoidal air cells, anterior, middle, posterior. Orbital plate. Superior nasal conchus. Middle nasal conchus. The ethmoidal air cells are paranasal sinuses, air-filled spaces, found in each ethmoidal labyrinth of the ethmoid bone. On each side there can be distinguished anterior, middle, and posterior ethmoidal air cells. The orbital plate of the ethmoidal labyrinth is a thin bony plate covering the ethmoidal cells from the orbital side. It forms the lateral surface of the labyrinth and participates in forming the medial wall of the orbit. Nasal conchae are curved bony plates that form passages of the nasal cavity, nasal meatuses. In total, there are 3 nasal conchae found on each lateral wall of the nasal cavity. Superior nasal conchus. Middle nasal conchus. Inferior nasal conchus. The paired superior nasal conchae and middle nasal conchae are parts of the ethmoid bone. They cover the ethmoidal air cells from the side of the nasal cavity and form the medial surface of the labyrinth. The inferior nasal conchae are separate bones of the skull. Development and ossification. The ethmoid bone is largely formed through endochondral ossification. Develops from multiple ossification centers, which fuse during early childhood. The ethmoidal sinuses begin to develop during infancy but are not fully developed until adolescence. Clinical relevance. Ethmoiditis. Inflammation or infection of the ethmoidal air cells, often associated with sinusitis. Can spread to adjacent structures such as the orbit, causing orbital cellulitis. Fractures. Trauma to the ethmoid bone can damage the cribriform plate, potentially causing cerebrospinal fluid, CSF, leakage and anosmia, loss of smell. Ethmoidal tumors. Rare but may involve the nasal cavity or extend into the cranial cavity. Congenital anomalies. Malformations of the ethmoid bone can contribute to nasal septal deviations or sinus development abnormalities. Surgical access. The ethmoid bone is frequently accessed during endoscopic sinus surgeries for conditions like chronic sinusitis or polyps. That's the end. Thanks for watching.